Did you recently start having short-term memory loss? Do you have vision disturbances, or do you frequently lose your sense of direction? Do you have trouble performing simple daily tasks or difficulties finding the right words? There can be many explanations for these symptoms. They do not necessarily mean that you suffer from Alzheimer's disease. It is, however, possible today to detect Alzheimer's disease with great certainty at a very early stage. This neurodegenerative disease starts developing in the brain a long time before its first symptoms start to show. It is time to consult a doctor in a memory center to get a precise diagnosis of what is causing your symptoms of memory loss. Your doctor will examine you and will ask you to perform a few simple tests. This allows her to get a more precise understanding of your symptoms and to exclude other possible causes. How does Alzheimer's disease develop? The disease originates from a growing presence in the brain of plaques and neurofibrillary tangles. This is due to an accumulation of amyloid deposits and abnormal forms of tau protein, hyperphosphorylated. The resulting lesions then lead to a progressive loss of neurons and synapses. This affects the performance of the brain. Modern in vitro diagnostics allow your doctor to establish with great clarity whether you suffer from Alzheimer's disease or not through the analysis of a few drops of CSF collected in the lumbar region. This collection is done by a trained specialist and is performed in seated position with local anesthesia. The tube is quickly transferred to a clinical laboratory for measurement of specific biological markers in your sample. The laboratory tests for Alzheimer's biomarkers and establishes your CSF profile. The results are instantly transferred to your doctor. Biological detection of the presence of Alzheimer's biomarkers or the absence of Alzheimer's biomarkers is an essential element in a reliable diagnosis of the disease. Knowing as early as possible whether you do suffer from Alzheimer's disease will allow your doctor to help you and your family adapt to the best possible care. Your doctor can prescribe the most adequate therapeutic follow-up and help you to anticipate the future.